That's where you want to be able to provide people that have gone through an infection with some kind of, resolve and some kind of solution. Right now, we haven't seen too much out of that. What what are the actual like people that are coming experiencing? You're saying it's like right afterwards. Are you doing it in a few treatments? How is it differentiated, and what are you combining with?
Okay, so I'm glad you asked this because this is an important thing. What we've learned. We haven't talked in a couple of years,
Yeah.
and it's a lot that we've learned. The one thing we've learned is this, and this would be a graphic and maybe another podcast. But as we accumulate these inflammatory loops, they kind of build on one another over a lifetime, and your body learns to coexist with them until the point to where you have basically neurological dysfunction. You have Lyme, chronic fatigue syndrome, fibromyalgia, Parkinson's. All of these things are basically many inflammatory loops from the immune system and the repair system stuck on top of one another. What we've learned is that if you have a condition like that you need to prepare yourself for multiple treatments of the TruDOSE treatment every 8 to 12 weeks. Why? Because at the cellular level, when we have, let's say that we're vitamin C deficient, and we can do a test and we can see our cells need vitamin C. What we've learned is that for our cells to acknowledge the fact that you're giving it vitamin C when it is deficient, it takes about 3 days for the cells to acknowledge that. It takes about 3 weeks for it to say, I'm acknowledging it. Now I'm going to put it into my short-term memory. And in 3 months, it becomes metabolically imprinted in the cell memory. That vitamin C, assuming that you continued with the treatment, it's done. That repair is fixed as far as vitamin C deficiency within the cell. What we've seen with the TruDOSE therapy is that at the cellular level, it is kind of mirroring that 8 to 12 week time point in that we give a treatment to somebody who has fibromyalgia, COVID long hauler. And about the 8 to 12 week mark is when we start to see the benefits, the therapeutic benefits start to plateau. So all of these improvements are happening. Eyesight, gut is being restored, sensory is being regained. There's so many things that are experienced to an individual, but that's when the improvements start to plateau. And it's not like you go backwards, but the improvements seem to kind of stop. And that perfectly mirrors what we know at the cell level, that those benefits that you've gotten from the TruDOSE therapy are now imprinted in the cell level. So what you don't want to do at the 8 to 12 week mark is say, I'm good. Let's just do one treatment and stop. No, because you're at a condition like fibromyalgia or long haulers that your body is at a point to where it wants to relapse back into the condition. And in order for it not to relapse, you hit it again at that 8 to 12 week mark. And it's almost, you can set your watch on it. Patients will say, I'm starting to feel it plateau. I'm starting to feel it kind of that flare come back. It's like, perfect. You're at the right time point. Get back in here and get the next treatment. And what we've seen, if you continue with that 8 to 12 week regimen, give yourself at least 4 treatments over a good annual year. You're going to, and we've measured this at the blood level. You are metabolically at the blood level, reversing the age of your blood. So if you have COVID long hauler and you're biologically 50 years old, but your blood is 60 years old, we have seen that it will literally take 10 to 12 to 15 years off of your cellular life at the blood metabolic level. Now, at that 4 treatment mark, listen, I don't have long hauler. I don't have fibromyalgia. What we tell people is you know your body better than you. And you know when this comes a point to where you have to make a decision. Is this a maintenance where I get it again every 6 months, or do I do it? We have a lot of people who do it as soon as they get a flare. So when they go into maintenance mode after that 4th treatment, it's like as soon as I get a flare, they get the treatment. But what we've also seen is that many people who live with these conditions and the cost of what it takes to take care of those conditions and the cost of doing the TruDOSE treatment and as much improvement it makes, they just keep doing the treatment every 8 to 12 weeks, regardless of how they feel, because this is cheaper. Not only is it getting them better, but it's cheaper than the cost alternative of potentially relapsing back to fibromyalgia or COVID long hauler. And it's definitely cheaper than, say, taking conventional medications and other treatments that don't work.
Yeah, it's really interesting how cellular memory plays such a big role in infectious disease. Whenever you see things like an infection, even after it's treated, little things could trigger it, and there are cycles of all that. So I do believe that's something you need to address